So let's continue.
Yes.
Wonderful. Okay, so who am I? As many of you know me, I'm Neeraj Sharma. I'm an internal medicine physician. I'm board certified in internal medicine as well as hospice and palliative medicine. I'm a fellow of the American College of Physicians. I've been in private practice of internal medicine in hospital and post-acute care settings now for 21 years as of July 1st. I'm a certified medical director in post-acute and long-term care from AMDA. I'm certified in healthcare quality management from AppCorp. And I've been a medical director and attending in multiple PALTC facilities in the DFW area for probably about 15 years. Let's talk about COVID-19. This is the SARS coronavirus 2 2019 virus. It's an infectious disease caused by this recently found virus. It was recently, not so recent now, December 2019 in China. We'll leave the conspiracy theories out for now. Symptoms are straightforward. You're going to see I use a lot of infographics today because it's a nice cheat. So, the main one is fever, generally over 100.4, but not necessarily. Cough, sore throat, difficulty breathing, chills, muscle pain, loss of taste or smell, nausea, vomiting, diarrhea, and headache and fatigue. The last three were actually added recently. Previously, we were just thinking fever, cough, and shortness of breath. Then we added some more. Really, it's a respiratory viral syndrome, but it's not the flu. We'll talk about that in a second. Remember, many patients have no symptoms. Now, we call this asymptomatic spread, but it's really more appropriate to call it pre-symptomatic spread, where they may be symptomatic later, but they're still spreading it now. And some may never develop symptoms, so it kind of covers everybody. And if you take a look at this is the study back in King County, Washington, the first nursing home that we knew of that had this. 10 of their patients were asymptomatic. Were symptomatic. 13 were asymptomatic, and they figured out that 56% of cases were infected and infectious but asymptomatic. Now that number has varied, and people don't really know. It's anywhere from 40 to 60% have no symptoms whatsoever. Some become symptomatic later. Who knows? It's just surveillance and testing is not where it needs to be able to figure this out for now. But it's real. As of yesterday, 3.48 million cases in the U.S., 13.4 million worldwide. I revised this presentation from back in May, and the numbers were remarkably lower. So it's kind of sad. 138,000 dead so far. We're not anywhere close to being done. All right. So as you can see, it's more common in younger middle-aged patients, and this is data from the Texas State Department of Health Services, Department of State Health Services, and this is basically a breakdown of cases of COVID. And you can see, it's the 20s, 30s, 40s, and 50s who get it most. It's mainly because that's the biggest chunk of population, but also because those are the people who are most mobile, getting around in the world, et cetera, et cetera. If you looked at this curve about a month ago or 2 months ago, the 20 to 29 was much smaller. I think in the reopening, as well as the protests that happened, that has resulted in that age group picking up a lot more. 80 plus has gotten up a little bit more than where it was, but here's the key take home for all of us in the senior living world. This is mortality. This is where mortality is for our patients in Texas. It is 80 plus who are most vulnerable. 70 plus as well, but 80 plus really is taking it on the chin. And if you look at it in terms of the percentage of population, they're not getting it that much, but it's really affecting them. This is the IHME website from the University of Washington. They've been modeling this repeatedly. You can go back and look at their data. Back in April, this curve was looking to go down to 0 by the end of May, early June. As we learned more and as things changed and data came out, they started to model this more accurately. And they've been pretty much on track. This was revised again day before yesterday. And right now, the deaths are anywhere from 34,000 to 14,000, depending on what we do. This red dashed line is if we just sort of let back on all restrictions. The current projection, what they think, is about 18,675. That's this purple line. And the green line is that everyone wore a mask. And, politics aside, masks work. We'll talk about that in a second. But this is a really eye-opening curve, because if you see the direction of where this is going, this is getting worse and worse and worse. All right, next. Coronavirus myths, we've talked about this before. Mosquitoes, alcohol and chlorine, vaccines, none of this works to stop it once it's already in. Antibiotics, saline rinses, thermal scanners don't work. Sorry, going a little too fast. There is no specific medicine recommended to prevent coronavirus, okay? You are seeing some physicians even advertise on social media saying, come and I'll give you hydroxychloroquine and zinc and vitamin C. I would run as far and fast away from them as you can, because there's no science to back that up. And a lot of these folks are conflating politics and medicine. And I think that's an unfortunate mix, because it lets people trust medicine less. And right now we need them to trust it more. Hot and humid still transfers. And there's a lot of other silly conspiracy theories I'm not going to get into, you know, pandemic, 5G, et cetera, et cetera. So there's no point to talk about that, so we won't. All right, it's a real thing, guys. People say that this is not real. This is a nice curve from the CDC that shows sort of the annual deaths from pneumonia, flu, right, every year, and kind of where our baselines are, right? So if you see that, and the green line is going to be pneumonia or influenza, and then the yellow line is going to be how COVID has changed it. This is what normally we're at. We're normally kind of sitting there, boom. That's got to be the wake-up call, guys. All right. So what do we do? 3 W's. Wear a mask, wait, or, you know, keep socially distant, and wash your hands. In the post-acute long-term care and senior care setting, what should we do? Don't work when you're sick. Work in one facility. Watch your household contacts. Everybody that you're in your household with is a risk to you if they're not being responsible. You can be doing everything right, but if your kids or your spouse or your brothers or sisters or anybody is not, then, you know, that affects you as well. Be patient. You know, we'll all get out to the restaurants eventually. Get takeout for now. Eat outside if you have to. Go to the mall if you want to. Wear a mask. And testing. Testing is a big thing. You may have seen yesterday, CMS had a national conference call where they did announce that they will be providing for nursing homes to begin with, and eventually I'm assuming other facilities will probably be able to partake in this eventually, depending how it goes, in hotspot areas, point of care testing kits. They're going to give them the testing kit. They'll have to sign a CLIA waiver or obtain a CLIA waiver, and they'll get about 400 of those testing strips for the point of care 15-minute turnaround testing, so they can test their own staff. It's not really for surveilling patients, it's for testing staff. And the thought process is, if you're testing everybody weekly, which is what CMS wants, that eventually people will start being more responsible. It's the analogy that if you have a drug test every Monday, you're probably going to be more responsible on the weekend because you don't want to lose your job. You probably don't want to not be able to work. So you're going to try to be more responsible. That's the goal. They're going to provide 400 test kits with each device, and beyond that, the facilities will have to buy them from the vendors. So, you know, nice deal for those guys, but they probably are making some money on it eventually, but not up for that. All right. So social distancing is important. We've talked about that. You know, it can't end at work. So we've got to be giving this message to all our staff all the time. You know, this is social distancing up here. This is not, right? We've seen far too much of this. This is from that very infamous gathering, I think at Memorial Day at Lake of the Ozarks in Missouri. I don't know why you have a pool next to a lake, but apparently you do. This is the impact, and many of you have seen this before, of how cutting transmission makes a difference downstream, right? Take a look at that. So, you know, a few people isolate themselves socially, or don't go to, you know, work in person, work remotely, don't go to a social event. Look at what you change in terms of the transmission. It's real. We talked about this. We were very good at flattening the curve early on when we had lockdowns in March and April. We did a good job of that. But then this is what happened. We said, okay, sure, we'll flatten that curve. Everybody's doing a good job. And then we just forgot about it. And this is where we're at now. And that's COVID fatigue. You see it in facilities, you see it amongst staff, amongst regular people out there in the world. Social distancing works, guys. This is the science behind it. If you look at the curve of the infographic on the right, that one person spent 30 days socially distanced. Just that doesn't mean that they're locked in their house. It means that they're not hanging out with large groups of people. They're wearing a mask. They're being responsible. And 75% reduction in mobility leads them to infect 2.5 people. That's if they're infected. And no social distancing, they give 406 people this. And on the left is sort of a more expressed view of that. So, we have to go beyond thinking of this as meaningful connection in the social distancing world. This is where we're at. So we talk about social distancing works, but this can't be what we do, right? But it is right now. So we've got to think, how do we think beyond this now?